Hello, guys. We're back again. I'm so excited. Thank you so much for joining us and being on our social media pages and really learning about the community resources that we have. So today I'm really excited. I met a new gal in town. She may not be as new, but she's new to me. And her name is Hannah Wishmeyer, and she's working with Standards Home Healthcare. She's a marketer, and what a phenomenal girl she is. And I'm really excited to highlight some things about her company. I know that the company that she briefly described to me was founded by two families, and they had a principles of including God appointed them to be in homes and give quality care to those that are in their homebound, and just really being a pillar of our community. So I want to thank them for coming on, and everybody to be a partner of Young's Daughters Funeral Home. So Hannah, I really want to welcome you, and if you can share a little bit about yourself and your background for our guests.
Yeah, absolutely. So I actually grew up in a medical family. My dad is a cardiothoracic surgeon, and my mom is a nurse. And I really wanted not to be in the medical community. I really tried hard, but then I fell in love with geriatrics and the geriatric population. I have worked for Standards twice. So I was with them for a year, and then I did assisted living and memory care for about 3 years. And now I'm back with Standards, and it's almost been another year. And I truly love this company. I love the owner of the company. He is a nurse himself. So we truly are a company owned by nurses, run by nurses. Um, the best part of my job is I get to market our nurses. They are the foundation of what we do, and they really truly are worth marketing. They're worth putting out there. I really say that we're the mom and pop shop of home health, because we are small, but we have nurses that actually care and would give that care to their own family members. So I really pride myself on working for a company
I
that can
love
do
the
that and say that.
passion. I
Right.
absolutely love your passion and your excitement about your company. But what about people that never heard of home health? Like, can you
Yeah,
describe what home health provides?
absolutely. So Medicare actually changed a lot of things at the beginning of this year. So with these new changes, we are able to provide short-term help in the home. So what we do is we come in, say you have a surgery, and we come in and we can do physical therapy in the home. We always say you can graduate from us and do outpatient, but we can provide that physical therapy in the home, as well as skilled nursing and occupational therapy, and even speech therapy is available. So we really can provide a lot in your home so that you're comfortable, you're in a space that is safe for you, and we come to you. So it really is a benefit, and it is 100% covered by Medicare. Some of the Advantage plans also cover a very big majority. So that's a really big bonus for what we do.
So that is a huge plus to know, because many people think home health is hospice, that the only way you can have home health is when you have a terminal illness. And that's not the case. It is, if you need any help in your home, your staff will come out and ensure that they have comfortability and that they're getting the therapies and treatments that they need. So I think
Right.
really highlighting that today is so important to so many people. How do you qualify for a service like that?
So since we are medical based, you go see your primary care physician. They will say, hey, you're really needing help managing your medications. Your blood pressure is a little wonky. Let's look at that. Let's get a nurse out to kind of provide some assistance with that, how we can better educate our patients on what exactly will help them in the long run. So we are able to go out and do that. It all stems from your primary care physician or your surgeon if you're having surgery. So really anything from a wonky blood pressure, if you have a wound, if you're experiencing more falls than usual, if you have a medication change, all of those things can be triggers to indicate the need for a home health visit. So it really is as easy as going to see your primary care physician and saying, hey, this has been off. What can we do to help? And that's where we come in.
Yeah, that's really neat. So it's like Meals on Wheels, but hospital on wheels, right? So
Right,
you bring it
exactly.
right back into them. I love it.
Yeah.
You guys are a rocking team. That is so exciting. Um, what is the process of receiving services? I know we talked about the
So,
quality of service. Yeah.
right. So basically, step one is talking to your doctor. You can reach out to me and I can do that step, but 9 times out of 10, you have to go see your physician. When you go see your primary care, like I said, you can say, hey, this is off. I have this spot that I'm not used to seeing, or like I said, my blood pressure is off. I say wonky because it can be high, it can be low, all of those things we can help. Kind of, even if it's us coming out monitoring and reporting back to that physician, that helps that physician know more what's going on a regular basis. They might see you once every 90 days, every 6 months, but if we're seeing you regularly, we can report that back. So you go see your primary physician, they send us an order for home health. So it could be skilled nursing, physical therapy, occupational therapy, or speech therapy. If any of those disciplines are needed, we get with them, we get those orders sent over, and we call you and say, hey, I got this information from Dr. So-and-so. We're going to get everything set up so we can have a nurse come out to see you at your home. So it's a pretty easy process. It just all stems from that primary care physician 9 times out of 10.
Wonderful. So what about insurances? Is it based on insurances, or do you have select insurances you accept only? How does that work?
Right. So we actually are able to accept a lot of insurances. The number one best insurance you can have is traditional Medicare. That will get you so much benefit. It is 100% covered by traditional Medicare. There are a lot of Advantage plans, so it just depends on the Advantage plan. We do accept Humana, Aetna, United Healthcare. We have a few others that are kind of some smaller insurances. Some Blue Cross Blue Shield. We do accept some WellMed and Tricare. So we can take Tricare all day long. You just got to give us that's what we do.
Well, that is amazing. I'm glad that you are so robust that you can accept a variety of insurances, where
Right.
I have seen that, private pay only is a thing. So I'm really enlightened to hear about that. But what really highlights Standard against any other home health companies? Like, if you could shine the light on you guys, what are you guys doing best?
I think truly our attention to detail with our patients. With my assisted living background, I want to know their dog's name. I want to know the best gate to go in. I want to know what their grandkids are doing. So I put that little piece in first, and then my nurses get to continue it. I really, truly think that we are the mom and pop shop because we take that small town feel and bring it to bigger cities like the Temple area. I think that my physical therapist, they all want to truly help that patient. And I think that's huge.
Well, that is awesome. I'm so glad you were able to take the time to come and share your resources and what you guys do. I think many families, don't have the knowledge, or maybe they had misconceptions of it. So thanks for, doing the myth bust theories and really just coming out to share your side of the story. I'm so excited. I'm glad our paths have crossed, and I pray for long future relationships to come.
Yes. Thank you, my friend. Thank you so much.
Yes, well, everybody, if you're going to want Hannah's information, well, we're going to definitely post it in the comments. If you are needing anything, please reach out to her. We have a cell phone on file. Do you mind if I give your cell phone, or do you want to give your office contact?
Share it.
Okay, so her cell phone is 254-744-6605. So if you are needing or wanting to send some referrals to her, or you feel like somebody needs their services, please reach out to her. She's one of the good ones, so I'm going to advocate for her. Well, thank you guys. Thanks for tuning in. Please watch out on all of our channels. Thank you.
Thank you so much. Have a good one.